Welcome to another episode of Pinsky Law Presents. Today we're going to talk about a new law that came about at the end of 2020, takes effect in early 2021. So by this time, if you're watching this video, you should be ready to implement a plan, or after watching the video, be able to implement and create a plan, something we can help you with if you need. But this law was created as a result of the COVID-19 lack of preparedness. Look, we haven't been prepared for a pandemic since, over 100 years ago. So this law is trying to get certain public employers to be prepared for another outbreak pandemic. In their words, the public health emergency. So this is an amendment to the labor law, adding a new section 27C, and it's entitled The Obligation of Public Employers to Develop Operational Plans for Certain Declared Public Emergencies. So let's talk about who must comply. Well, it applies to counties, cities, towns, and villages. To the extent that a city or village has a fire department, then yes, the fire department has to comply. And there are about 4 or 5 towns in the state that have their own fire department as a result of a law passed back in 1931, so they would have to comply, but they're typically called fire districts, even though they're a little bit different. So what about fire districts? Well, they're political subdivisions of the state under Town Law 174, so they have to comply as well. What about the independent fire companies, those who contract with the towns? Well, I think there was an oversight here. Now, you can argue that a town can't have a fire department, but is in control of the fire department located within its boundaries. That's pursuant to Not-for-Profit Corporation Law, Section 1402, that places a town in control of a fire company or fire department which is within the fire protection district. But that's not a fire department of the town. So, my opinion, and maybe they'll amend the law later, but as it stands right now, my opinion is if you are a fire company and you are not in a village, you are not in a fire district, and you are located within a fire protection district of the town so that you are under the control of the town as an independent fire company, you would call yourself, I don't think you have to comply. So turn off the video and everyone else can keep watching. So what about ambulance services? Not unless you're part of a municipal department, such as a village's or a city's ambulance department. And again, if you simply are an ambulance service that contracts to provide services with any of these entities, I don't think you have to comply. You're not a public employer. What is the obligation of a public employer? Well, you've got to prepare a plan for the continuation of operations in the event of another COVID-19, in the event that the governor declares a public health emergency involving a communicable disease. The plan has certain components, and now they're not complicated. Again, we can help if you need, but they're not that complicated. It's a specific description of the protocols that the employer is going to follow in order to enable non-essential employees to telecommute, including, right, but not limited to, facilitating or requesting the procurement, distribution, downloading, installation of any needed devices or technology, including software, data, laptops, or cell phones. I'll explain this. The transfer of office phone lines to work to personal cell phones or home phones, all in the event that you can't be in the workplace. In other words, these first two components are everyone, we have to leave work, go to work from home, flip a switch, we can keep doing our job not in the office so that we can basically shelter at home. Okay, so who are non-essential employees? Well, look, this is just for the fire service and the ambulance service of those, villages and cities that this lecture is for. So I'm not going to talk about other businesses. I'm going to talk about the fire and EMS service to the extent they're part of a village or a city, right? Or I suppose a county can have an ambulance service too. So who are the essential employees? Well, we know those, EMTs, firefighters, drivers, all the personnel who actually go to calls. Who are non-essential employees? Well, there's no perfect definition of this. But what we've learned from COVID, certainly, is that anyone who can do their work from home would probably be non-essential. So, for instance, if you are a purchasing officer, you probably can do the ordering from home. Now, there's exceptions. If you're checking supplies or inventory, clearly you have to be in the firehouse. But to the extent that anyone can work from home, they need to do so and limit their presence in the firehouse. So non-essential employees, right, would include also secretarial staff that they can do their work from home, except, of course, FOIL requests, right? They might have to go into work to adhere to a FOIL request. Now, all I'm going to say about that for the moment is that for a FOIL request, it's not urgent. So probably you can delay, and we'll see, future executive orders if this ever happens again. We'll see the ability to say, look, we're not going to go into work just to get you your minutes of the last meeting. Maybe they'll be on the website, or we're not going to find this historical document for you just to go, just to force us to go into the workplace. You'll get it later. So probably you'll be allowed to do that if, God forbid, there's another pandemic. So finance people, record-keeping people. If you can do your work from home, then we need to enable you to be able to do that. You don't have to do all your work from home, but as much as you can, the office has to flip a switch and be able to allow you to work from home. And in truth, a lot of businesses today using technology have prepared themselves to do that in the future. So you have to create 2 lists, and that's probably step 1. First, a list and description of positions and titles considered essential. Firefighters, EMTs, paramedics, drivers, chiefs, etc. Right? And then a justification of such consideration for each position and the title included. This is not hard. In other words, the justification is they have to be at the station to get on the fire truck, right, to go to a call, or get on the ambulance and go to a call. This isn't really difficult for fire and EMS, let's be fair. For non-essential personnel, however, I would suggest that you include them, as well, because you should state in some occasions they have to come in. For example, if you are a town ambulance service or a village ambulance service or city ambulance service or fire department and you provide ambulance services, your inventory is important. So if you have a purchasing director who's got to come in and do inventory, right, or maybe you have a CQI professional who needs to come in and do that, you would put them on the essential list and state that they will come in at certain times to do their job whenever they have to be present, like to count supplies. That's the example I would give. Okay, and so we're suggesting that you create more categories, right? Those who are essential, they can work from home sometimes, but they've got to come into work occasionally. Now, what is telecommuting? Well, we know what that is today, right? But the employer has to determine how to permit personnel to perform their jobs from home. How do you do that? Well, you've got to have the ability, as I've said a number of times now, to flip a switch and go remote and be home. That requires servers. That requires secure VPNs. That requires that people have laptops, or maybe they can pull out a laptop. And that's not so easy either, because if people don't normally work on a laptop at work, you've got a laptop that's got to be updated and kept current, right? It's got to, if you plan this in 2021 and the next pandemic is in 2040, I hope your computers have been updated, which is going to be expensive. So laptops, the ability to go remote, the hardware, all of that has a real impact on you in cost. So are we going to allow persons to use their own laptops? If so, VPNs have to establish a one-to-one connection with that laptop. There's a lot of considerations on how are we going to allow people to connect from home and still log in and do their work. And I would suggest to you that's going to be expensive. Why? Because having laptops on hand that may never be used by somebody, right? The secretarial staff, whoever, might always use a desktop. Maybe we now have to consider switching to laptops that would be kept current to move over. That's a technology issue, but I'm suggesting those are the types of things you're going to have to now think about. Phone systems, we're going to have to upgrade. Look, hopefully someday there's going to be grants for this. But right now, this is a, unfunded mandate that you're going to have to figure out. But how do you switch your phone system so that you can now work from home? You may not have that ability. You may not have that ability with your server. You may not have that ability with a lot of the things that you're going to need to flip the switch. Financial controls, this is my warning. don't implement poor internal controls. I think that allowing persons to do electronic banking from home, right, may be dangerous. I think that allowing persons to take the checkbook and all finances home may be dangerous. Doesn't mean it should be prohibited. It just means that you have to have good internal auditing. Now, I can talk about internal auditing, but basically what that means is somebody without check writing authority who couldn't steal money, right, is going to audit the financials when this crisis is over or when the employees come back. You want to make sure somebody is looking at the electronic banking, is looking at the checks, is looking at the financial statements, and that you don't accept as an excuse, oh, I lost that during the pandemic. I lost it at home. Somebody has to be monitoring the person who's doing financial work at home. Don't implement poor financial controls, and that's really the same as your normal financial controls, right? Somebody should be reviewing what was spent and charged and make sure there are receipts, etc. Okay, staggered shifts. I think that this is a very easy thing to do if you're purely paid fire, purely paid EMS. But wow, this is really tough when you're a combination or an all-volunteer fire or EMS agency. The law requires that you create a description of how the employer will, to the extent possible, and those are very important words because it may not be possible, but stagger work shifts of essential employees, in order to reduce overcrowding on public transportation systems and at work sites. Okay, well, if you're FDNY, this may be an issue for you because a lot of FDNYers, come in from the outside counties and come into Manhattan or the Bronx or whatever to work. For the most part, the fire departments normally in their, rural or urban areas don't rely heavily on public transportation. So this is just trying to accommodate public transportation, but I think it really focuses on a bigger issue that we should consider. And this may not be in the law so stated, but I think you should consider it. If you're at, let's say, 12-hour shifts for a paid, can we go to 24? Can we stop the shifts from interacting? Now again, easier to do with paid staff, very difficult to do with combination with volunteers who come in at any time and may cross-infect the shifts. But this, to be clear, this is only saying limit the number of people going back and forth on public transportation. Not going to be an issue for most of you. You do have to have a number of policies in addition to what we've been talking about. So you have to have a description of your protocol that you're going to implement in order to procure appropriate personal protective equipment for essential employees, right? So that is us. Now we're talking the N95s, we're talking all the disinfectants, whatever we're going to need to keep treating a pandemic type communicable disease, airborne disease or whatever, you're going to need personal protective equipment. Now, we know what that is on the EMS and fire side. We're used to it. But here's where it becomes a problem. Now we need so much of it, as you are all well aware of how much we've needed with COVID-19. But you're going to have at least 2 pieces, under this law, 2 pieces of every type of equipment. And you have to plan, right, for it to be replaced and permit immediate access in the event of an emergency declaration. And you have to have months of this on hand. That's the problem we're going to have. You have to have, 2 pieces of each type of equipment for every employee. Now, we'll talk about volunteers in a minute, right? I don't suggest you say we have 100 volunteers or we're going to get that. I suggest you do it by shift. So we have 4 people on a shift, or we expect 6 people to come in to a call a day, and you do it that way, right? Do it on the number, not specifically we have John, Jane, Mary, and Joe, and every one of them needs their own stuff. But you have to have the items in stock. They have to be in good condition. That's going to be a problem. We'll talk about it in a second. And you don't have the ability under this to order it. In other words, this is going to be the masks, gloves issue where we couldn't get it. And now you have to have 6 months, by law, 6 months of this in stock in order to operate, again, with all your regular personnel who would have 2, and I'm going to suggest that 2 isn't sufficient for a moment, but you have to have 6 months of this on stock. Now, this is really a problem. Gloves don't always last that long, but gloves are easy. We use gloves, right? So you just, keep pulling them out of stock. But okay, now we have to have 6 months of gloves on stock. Most ambulance services don't keep 6 months of gloves. 6 months of N95s on stock. Now, why is this a problem? This is a problem because these things degrade. This is also a problem because let's assume you run 5 calls a day, 2 calls a day, 20 calls a day. The 2 per employee is not sufficient potentially because certainly for gloves, and again, gloves are easier, right? But masks, you may not wear the same mask, or maybe you do throughout the day. But your body isolation suits, you need 2 per day? Well, wait a minute. If we're going to be wearing this all the time, how much do we need? You have to perform this evaluation. And I suggest it's way more complicated than they're thinking. I don't think that they thought about fire departments and the burden on fire departments and municipal ambulances. Or maybe they did and they didn't care. But keeping this amount on stock for a busy service is going to be a very difficult task. It's going to mean that you're constantly moving things out so they don't expire and putting new things in. You may have to go to your hospital and work out something with your hospital. That may be the best way to do this. It may be easier for you to go to a hospital or to have a group, stock somewhere where you can constantly be pulling things out and in. You know that if you leave gloves there for 10 years, 20 years, that's not going to be in such good condition when you go to open them up. Same with masks and body isolation suits and glasses and goggles, etc. This is going to be very expensive. It's going to be very complicated, and I suggest you should get somebody who's really good at this, and most likely you should talk to your hospitals, see if you can work something out with them. Now, towns and villages all have to work something out. Somehow we have to try to come up with a way to stock all of this. This is the big part of the law. Look, flipping the switch, go remote, I talked about the laptop issue, that's difficult, but this is going to be tough for a lot of places, and it's expensive. So you have to have a contamination exposure protocol. I don't think this is going to be difficult, right? And I've given you lists of what's required to have it, quarantine procedures and requirements, testing of others, tracking of exposures and contacts, filling of shifts, replacement shifts, right? The time that you have to remain home after an exposure. And I'm going to give you some examples, right? Any available treatment and return to work requirements. Look, we don't know what the next pandemic or next big disease is going to be. We know how to react to COVID. We now know after a year of how you're supposed to distance and what a proper quarantine period and what body isolation works. We're not going to know that for the next one, right? We'll be better prepared, no question, but we are not necessarily going to know. So most of what I suggest here is we will quarantine as the CDC requires. We will test as the CDC requires. We will track exposures as the CDC requires. We will fill shifts to limit exposure, etc., as the CDC requires, right? All of those things. We will have employees who are exposed remain home as the CDC requires. That's my suggestion to you. How are you going to know what the next disease requires? You didn't know for this one, we're not going to know for the next one. So you also, in your contamination, your exposure protocol, you have to detail the actions to be taken to immediately and thoroughly disinfect the work area. Very easy. Very easy for EMS and fire because you should all have your OSHA bloodborne pathogen standards. That's what you implement. We will, right? We will do that. However, what about the other areas? Well, here's where I've disagreed with some of fire chiefs and ambulance services, how they've done things. You know that, for example, turnout gear should never be in a food area, right? Body isolation stuff should never be in a food area. It should never be in a sleeping area. If you adhere to that and you never cross-contaminate from the garage, from the ambulance into the, the living area, then you're fine. Then follow your isolation practices and your cleaning and normal disinfecting practices because you won't cross-contaminate. But you really have to be much better than we've been, because frankly, I've seen a lot of ambulance services. They get off the ambulance, bring in their PCR, jump into whatever member room or rec room or day room, and they start doing their work. They haven't done anything to decontaminate themselves. So that is going to be a problem. What this will probably be is we will disinfect, and what I would say is in accordance with CDC guidelines. Again, I could give you very specific suggestions. they would only model what the CDC says today for COVID-19. We don't know what the next one is going to be. So take the easy way out. You're not getting fined for not having a good enough policy, and simply follow government recommendations. Okay, so you've got to have a policy on available leave in the event of need of employee to receive testing, treatment, isolation, or quarantine. Again, in accordance with CDC guidelines. We don't know what testing and isolation they're going to need for the next disease. It could be a day, it could be 10 years. We just don't know. The protocol cannot involve any action that would violate any existing federal, state, or local laws, including regarding sick leave or health enforcement, health information privacy, etc. So what is that? Just have a simple statement that says, no such policy will, unless what? We're not going to violate anything unless the CDC says we need to. These are tough issues. COVID's presented a lot of tough issues, but just have that simple line. Tracking protocol. You've got to develop a protocol, guess what it's going to say, everyone, for documenting the precise hours and work locations and including off-site visits for essential employees and contractors. Again, we're going to follow CDC guidelines, whatever they're going to be in the future, right? We have all those from the CDC, or we should. The purpose of this is to ensure that contact tracing, which we found is very important, right? That's done for your personnel to track the spread of the disease in order to ensure that, the benefits and protections offered to persons who could be infected are offered. You are required to arrange in advance for emergency housing. This is going to be something to further contain the exposure of the infected or exposed individual. Whoa, we didn't do that for COVID. We just said go home and live in your basement and don't talk to anybody for 14 days. How do you do this? Well, maybe it's go at your house, right? And we'll have to arrange for your family to be somewhere else. But we can't, as an employer, tell your family to leave your house. So we're going to have to say, maybe we're going to send you to a hotel. How are you going to do that? The hotel's all closed down. This is going to take some planning. This is going to be very specific. Maybe you rent a house at the time. Who knows what you're going to have to do? How are you going to put up people who are infected? We didn't do that really today. What we did is we said be home. That may be your practice, but we've got to avoid exposing others. Maybe we have a part of the firehouse, if it's big enough, where we use as an isolation room, and we don't allow people anymore to sleep on shifts. They have to be there, but we're going to isolate everybody in a bunk room for 10 days. I think people would go nuts. In any event, you will see. This is going to take a lot of planning, and how are we going to put people up? We will post on our website a protocol that people can model. Expect that it's going to take the easy but important way out. Follow the CDC guidelines. Do these things, try to accomplish these things. Some of this is going to be very tough. And this one, telling people they have to shelter at their house, fine, but not expose other, people like their family, that's a tough one. Let's talk about unions. An employer has to work with their union, share the plan, and get comment. They don't have to follow them, but they have to allow the unions to review and comment on these plans. Now again, this is going to be a lot of unknown if you go by my model, which is for fire departments and ambulance, don't get so specific, follow the CDC guidelines. Maybe I'm taking the cheap way out, but you predict the next pandemic and tell me what that should say. But the unions will have concerns, right? What are our pay going to be? What are our protections going to be? What's our off-duty and on-duty testing? Well, you should have already dealt with that now. So this, we've learned by trial by fire, we've learned how to deal with this. You should basically take what you've done now, right? If we are sending you home, you are guaranteed sick pay if you were exposed on duty. What if you weren't exposed on duty? What if you were exposed off duty and you want to come to work, but we say you can't come to work for 10 days? What then happens, right? All of these things you have to deal with, and these unions are going to have concerns to address these issues. What do you do about light duty, right? All of these things, very important union issues. You can't violate the collective bargaining agreement, but you do have to work with unions. Okay, so you're not obligated to implement the comments by your unions, just so you know, but pay attention to those which are mandatory subjects in negotiation, and I would say pretty much all of these are mandatory subjects in negotiation. Okay, I don't want to go too far off onto the union side, but One last comment, as with every law, you cannot retaliate for them getting upset about this, for them commenting, for them opposing it. All right, you can't retaliate for their comments and suggestions. Okay, lastly, what are the complaint procedures? Well, you have to have in your policy complaint procedures that state how the employee can complain to the Department of Labor and provide protection for any good faith complaints. You should provide a form, you should provide contact numbers, state that the complaint will be confidential, you won't retaliate if somebody makes a complaint, right? You should have a whole procedure. Be very careful about saying, well, you have to complain to us first. That's a difficult one because then they know when somebody has complained, they know who it is. But I would have a complaint process. So we will post a general policy to assist you. We will post some general notes on what you should fill in the blank with. We can make a lot of suggestions for you, but ultimately this is going to come down to who are you able to work with for storage and obtaining supplies, who are you able to work with for housing. I think those are going to be your biggest issues, and the technology issue is going to be pretty tough these days, making sure that you can flip a switch and just go home. I would suggest that, allowing people to take a laptop home means you got to have a laptop there. Right? This is going to be some work on your part. So this is not going to be a just copy a policy and, forget about it. You're going to have to prepare and have very specific technologies and equipment in place to deal with this. If there's anything we can do to help you, we're certainly happy to. As always, on Pinsky Law Presents, we're keeping you up to date with everything you need to know about the most critical laws and developments. Thank you, and see you next time on Pinsky Law Presents.